heart disease in the next 5 years, as measured in this particular study. 44% risk of developing cardiovascular disease in the next 5 years. I just want to go back to that, actually. One of the issues that I have, and many other colleagues have as well, is this issue of age. Because in order to calculate the risk, and why am I interested in risk anyway, 10-year risk, why is it 10 years that you're looking at? And the reason is economics. So what we want to know is who's worth treating in that, over that 10-year period in order to recover the costs from having to treat patients. And the problem with it is that cardiovascular disease doesn't really fit very neatly into that little package. Cardiovascular disease occurs over decades, not just 10. And actually, if you treat patients early, they're more likely to benefit than if you wait until they've got heart disease and you treat them late. So in some senses, this gives you a false sense of righteousness, as it were. It would be better to treat more people early than waiting until they've got heart disease and treating them late. I wanted to introduce this concept of biomarker. I've said that cholesterol was a biomarker. What is a biomarker? Well, a biomarker is a measurable characteristic that reflects the severity and presence of some disease or physiological state. And in this case, I've mentioned two examples. One is a troponin, which is used to detect, to diagnose a heart attack. A very specific marker for that. And the other is beta-HCG, which is used for determining whether a woman is pregnant or not. Again, highly specific. So that's why. So there are many sort of biomarkers that we use in medical practice, and many of them are extremely